And good afternoon. It is noon, and that means it is time for our regular Friday Lunch and Learn. Now, today we're going to be talking about EMFs. Excuse me, electronic or electromagnetic fields. Okay, I call it electromagnetic frequencies because it is a frequency and it does damage your skin. It does damage your DNA. And so we're going to talk a little bit about that, and we're going to talk about some different herbs and foods that are going to help with that. And so what you're going to want to understand, your takeaways at the end of the day, are that electromagnetic fields are very, very dangerous to your health, and we are surrounded every day, all day, by these different frequencies. So this article was written by Dr. Sania McCullough, and we've talked about her before. We've looked at her reporting before, and she's very, very good. She wrote a book called Go Wild: How I Reversed Chronic and Autoimmune Disease. Okay, so we want to look at that. She's very, very sound, and I love the research that she brings to the table because it's just great. So our exposure to EMFs has continually become greater and greater and greater. Back in the day, we had televisions that emit low-level radiation, and then we got microwaves that emitted radiation, and then we have phones, smartphones, and we had cell phones first, mobile phones, and then we have smartphones, and now we've got 5G towers, and we've got all this stuff that we're all exposed to all the time, and it does damage our DNA. And so we're going to talk a little bit about that, what we can do about that, and what are some of the kind of things that we can notice in our bodies if we are susceptible to EMFs. Now, a lot of people are not, everybody is susceptible, but a lot of people do not have any symptoms that they are susceptible. So what are your symptoms? Your symptoms can be allergies, your symptoms can be skin issues, your symptoms can be anxiety, it can be just a lot of different things. And so we want to look at what this is and how we can maybe help ourselves, okay? So EMFs, the FDA controls, OSHA controls, they've got all these, this level of radiation is acceptable, this level of radiation is not acceptable. So the safe, current, established standards of exposure to EMFs is largely based on thermal effects, the heat that comes off of your devices. However, the most damaging components may be the non-thermal direct tissue penetration. The long-term health effects of low-dose exposure to EMFs were scarcely investigated prior to the mass introduction of these technologies. In 2009, a study was published in the Pathophysiology report that long-term exposure to EMFs increases the risk of both Alzheimer's disease and breast cancer. So this is really, really important. Now, I know that a lot of women wear their phone right here in their bra. That is not a good thing because it is very, very conducive to developing breast cancer, so we don't want to do that. The men, if you wear your phone on your belt, you can be having that low-level radiation going right to the testicles, and it can cause testicular cancer. What we have observed in the holistic field is that depending on where you wear your phone, if you're a man, on the side where you wear your phone, that testicle is usually smaller. If you are a woman and you wear your phone on your belt, then that ovary on that side is technically measurably smaller. And so we do know that the EMF radiation goes in and it damages that. We do know women that wear their phone in their breast, in their bra, and it does cause breast cancer, and we don't want to do that. So specifically, EMFs, electromagnetic frequencies, can penetrate tissue and decrease the production of melatonin, which may contribute to the development or progression of Alzheimer's disease and breast cancer. EMFs may also affect fertility in both men and women. A study published in the Central European Journal of Urology in 2014 tested sperm mobility and DNA fragmentation in sperm samples from healthy men following exposure to cell phones in talk mode for 5 hours. Now, I don't know if that means that they have them on speakerphone. I'm not quite sure what that means. They don't explain that. Compared with the control group, mobile phone radiation exposure decreased sperm mobility and increased DNA fragmentation. Now, sperm motility, sperms have a little tail. The tail pushes them up the birth canal into the uterus where they meet with the egg and all that kind of stuff. That if you're not having good swimmers, you're going to have a problem with that. Additionally, when you are exposed, if you're a man and you're exposed to the EMF, it damages the DNA in the sperm. And so what does that lead to? That leads to a non-viable pregnancy. You know, you'll have a miscarriage and that kind of thing, or it can lead to birth defects. We do not want fragmented DNA, okay? If you don't have good swimmers, you're not going to get a baby. So cell phone radiation has been proven to decrease sperm motility in people that wear their cell phones on their body or they're exposed to cell phone radiation. In 2017, a prospective cohort study of 913 pregnant women published in the scientific reports conclude that women who were exposed to higher amounts of EMF radiation had 2.72 times risk of miscarriage compared to women who had lower EMF exposure. So what we're seeing here in the clinic is a lot of infertility issues, and I'm just wondering if possibly the EMF exposure is something that is contributing to this. So I am surrounded by Wi-Fi. You're not in my office, but we do have Wi-Fi. Why is that? Because we've got programs that we need to run and all that kind of stuff. I wear in my body, okay, on my body, in my bra, okay, because EMFs come in from the left side of the body. I wear a specific device on my person to repel the EMFs. Why is that? Because I'm surrounded. Okay, we've got towers outside. You've got towers where you are. You may think that you are protected, but unless you're in the wilderness and off the grid, you're probably not protected, okay? So you have to do what you have to do in order to mitigate the exposure, right? Nullify the exposure, because we don't want to be damaged. We don't want our tissue damaged. We don't want our proteins and our DNA damaged by this EMF radiation. And so that's kind of what we're looking at. If you are a woman who is having trouble keeping your pregnancies, you're miscarrying all the time, then you might want to look at your exposure to radiation and see what that might be contributing to. This study provides fresh evidence about the exposure and the miscarriages. This study provides fresh evidence directly from the human population that magnetic fields, non-ionizing radiation could have adverse biological impact on human health. That's all humans, whether you are pregnant, trying to get pregnant, man, woman, old, young, it does not matter, okay? What they are finding, and I don't have the statistics with me right now, but children with cell phones, and I am absolutely against children having cell phones. I'm throwing that out there. And the reason for that is their brain, their skull is much, much thinner than an adult's, and that radiation can penetrate and damage their brain a lot more easily. There's all kinds of studies out there. I want you to look at that. I want you to, if you have to have your children have a cell phone, I really want you to monitor, have it on speaker, have it away from their body, not have it up to their ear, and that kind of thing, because it's extremely, extremely dangerous, all right? EMFs have been known and reported to increase the production of free radicals and reactive oxygen species, oxidative stress, leading to increased oxidative stress. Recent studies have concluded that oxidative stress plays a major role in the etiology of chronic diseases such as, and listen to this, cardiovascular disease, aging, cancer, and brain dysfunction. Now, we know all of these are older people diseases, right? You don't have to have these diseases just because you get older. I'm older, okay? I'm protecting myself against these diseases. How am I doing that? Well, number one, I am scanning myself. We've talked about this. You've seen this Pharmanex scanner here. This measures how many antioxidants you have in your system. If you are not eating fruits and vegetables, if you're not absorbing your fruits and vegetables, then your antioxidant level is really, really low. If you're exposed to EMFs, if you're exposed to any kind of environmental toxicity, which we all are, all right, then your oxidative stress is high, your antioxidant reserve is low, and so you're going to not be able to protect yourself against the free radical damage, and you're not going to be able to maintain your health, and you will fall prey to these older people diseases. I'm not buying it. I'm not going to do that. I'm going to protect myself and do what I need to do. Consequently, it is plausible for long-term exposure to EMFs may contribute to the formation of chronic diseases, okay, based on the increased risk for breast cancer associated with wireless phone. The International Agency for Research on Cancer classified radioactive magnetic fields as possibly carcinogenic to humans. Now, are we all going to forget about our cell phones? Absolutely not. We have to have them to function in the environment that we need to function in. There are things that we can do to protect ourselves, and I'm going to show you and tell you the different herbs that are neuroprotective, tissue protective, DNA protective, so that you can do what you need to do so that you can survive in our current environment, all right? The European Commission's Scientific Committee on Emerging and Newly Identified Health Risks concurred that low-frequency EMFs are possibly carcinogenic based on the evidence of increased incidence of childhood leukemia and Alzheimer's disease in adults. So we know that that is on the rise. If you do any kind of research at all, you know that cancer is on the rise. 1 in 3 of us will get cancer in our lifetime, and we know that childhood leukemia is absolutely on the rise, all right? So electromagnetic fields can lead to electromagnetic hypersensitivity, which is a phenomenon characterized by the appearance of symptoms after exposure to the electromagnetic fields, all right? So this ranges from acute chronic inflammation across multiple organ systems, but they mainly appear in the skin and in the nervous system. So remember I told you those people that are very irritable, those people that have rashes and that kind of thing, well, those are symptoms of electronic magnetic fields, and so we want to make sure that that is something that we look out for. For instance, fatigue, dizziness, headaches, problems with concentration or memory, depression, burning sensations on the skin, and sleep disturbances were common symptoms for electrohypersensitivity syndrome, okay? Given the current research, it is plausible that reducing man-made EMF exposure can improve health and wellness, especially in sensitive populations. Various strategies for EMF mitigation are available, such as shielding and distancing. Now, shielding is what I told you I wear in my bra. I also have my cell phone away from my person. It's very, very rare I will wear my cell phone on my person. And when I do it for a very, very minimum amount of time, okay? One of the often overlooked strategies involves herbs and spices due to their antioxidant ability. So we're going to go through a few. I hope I can get them all in today. All right, and there are cautions with every one. So just because it's natural does not mean it's right for you. You need to see your healthcare practitioner. You need to be tested. We test for everything that we give people here, and we test to see if it's something that your body wants or something that your body doesn't want. If you're on prescription medications, a lot of these will interact with that. And so there is a caution. There is hope, but there is a caution as well, okay? So one of the things is reishi mushrooms. Now, if you've done any kind of research in healthcare at all, then you're going to know that mushrooms are fantastic for immune modulation, especially where cancer is concerned. So reishi mushrooms are a fungus, not an herb. However, it is edible, right? You can eat these. They have many health benefits. We've actually got a product here in the clinic that has had clinical trials with breast and prostate cancer, and it has shown to be absolutely fabulous if you're dealing with that. So there's all kinds of medical clinical studies on this, people. This is not just me saying this. This is backed up by real clinical research. And so that's why we like to do what we do, because we don't just like, oh yes, I'm back from the hippie days and I do all the herbs and mushrooms and all that kind of stuff, right? No, we do it with clinical evidence, so we know what we're doing. So the reishi mushrooms can prevent and reverse cancer. What causes cancer? Fragmented DNA, EMFs, all those kind of things, having a toxic internal environment, having an anaerobic internal environment, okay? It boosts the immune system and it reduces fatigue, okay? Reishi may provide protection from EMF radiation. The Journal of Food and Chemistry in 2010 reported that reishi repaired cells that were damaged by gamma radiation. The authors concluded that the use of reishi is a promising approach for protection against radiation exposure. It has been known to suppress inflammation, scavenge free radicals, all right, decrease oxidative damage. So, but there is the caution here. Reishi mushrooms can cause dizziness, dry mouth, itching, nausea, stomach upset, and rash. Individuals with bleeding disorders or low blood pressure, as well as women who are pregnant or breastfeeding, should consult with their healthcare practitioner before they look at reishi mushrooms. Now, if I had any kind of immune issue, reishi mushroom would be my absolute first pick. I'm not on any medication. I don't have any, things going on with my body that are not right. And so I can do that and be very, very satisfied that I'm getting the best thing for my body. Now, ashwagandha, you might know ashwagandha. You may have heard of ashwagandha. Ashwagandha is the #1 antigen. So what does that mean? That means it will adapt to whatever situation that you're dealing with. So ashwagandha is used for a lot of different things. Some people call it the thinking herb, that it just knows what your body needs and it goes to repair and to provide those benefits, all right? So scientific studies, again, remember we are all scientific here. Scientific studies confirm ashwagandha contains antioxidant, anti-inflammatory, immune modulating, anti-stress, anti-Parkinson, anti-Alzheimer's, anti-diabetic, right? That's a mouthful. Cardioprotective, neurodefensive, anti-cancer properties. Do I need to say more? Ashwagandha inhibited metastatic breast cancer in rats with minimal adverse effects, according to a study published in the Public Library of Science. It has also been reported to mitigate the undesirable side effects of gamma radiation, thereby protecting the liver from oxidative damage. All right. So, pregnant women should not consume ashwagandha. Ashwagandha can lower blood pressure and blood sugar and elevate thyroid hormone levels. So, speak to your practitioner before you do that. If you are on any kind of blood thinners, you really need to talk to your people. But if I had a choice, if I could get on one of these herbs and it would thin my blood and lower my blood pressure, I would rather do that than be on a beta blocker or a calcium blocker or whatever kind of blockers they have out there, okay? The third one we want to talk about is also very, very common. You've heard about this. You've seen this. It's all over the place. It is green tea. Now, green tea has been used for years and years and years in traditional Asian medicine, and that is because it has an abundance of antioxidants. What do antioxidants do? They are free radical scavengers. They eat them up. and they take care of the oxidative stress that you have. All right, it is there have been studies that confirmed the numerous health benefits, including prevention of cancer, prevention of cardiovascular disease, as well as anti-inflammatory, antioxidant, anti-arthritic, antibacterial, and antiviral effects. So if you are somebody who is healthy and you want to have a natural go-to antibiotic right there in your home, I would get some green tea. I would make sure that it was minimally processed, so it's not like dead when you get it. When you get the really, really cheap herbs at your grocery store, your big box store that's buy one, get one free, you're not getting good stuff. I'm just telling you, they don't have the cofactors in there, and it's not going to do what you want them to do because it's been over-processed and it's been killed. So we want to have live herbs that have their own vibrational frequencies, because it's that vibrational frequency that goes into your system that brings you to health, okay? In a 2011 study published by Neurotoxic Research, they reported that green tea can protect the neurons in the brain against cell phone radiation. Cell phone exposure for 24 hours resulted in neuronal cell death in cultured rat cells. Green tea, however, prevented this cell death. Quote, our research suggests a neuroprotective effect of green tea polyphenols against the mobile phone irradiation-induced injury on cultured rat cortical neurons, the authors wrote. The second study, published in 2016 in Environmental Toxicology and Pharmacology, say all those words, was based on a randomized controlled trial. It reported a protective effect of green tea on workers exposed to low-frequency electronic magnetic fields of high-voltage power lines. So in this particular study, they studied the linemen, what was going on in their brain, because they're up there all the time. Then they did a 12-month course of green tea, and they found that in that 12 months, the oxidative damage was diminished. So even after you've been damaged, if you take green tea, it can mitigate the effects of the damage. They go on to say long-term use of these polyphenols could be an efficient protection against health issues induced by high-voltage power lines. Now, caution here. Individuals with the following conditions should speak to their healthcare provider before consuming green tea: anemia, anxiety disorder, a blood clotting disorder, heart disease, diabetes, high blood pressure, glaucoma, irritable bowel syndrome, liver disease, or osteoporosis. Women who are pregnant or nursing should consult their healthcare practitioner. All right. Turmeric. Now, we all know about turmeric. Turmeric's been used for years and years and years in the subcontinent of India, right? Turmeric is very, very difficult to absorb, but there's a lot of turmeric out there that's doing you absolutely no good. It's got to be combined with a black pepper cofactor in order to get it into the cells. And so make sure you're getting a good turmeric if you want to have this benefit. So EMF exposure can increase the production of pro-inflammatory cytokines such as tumor necrosis factor alpha, interleukin 6, and interleukin 1 beta. These pro-inflammatory cytokines can contribute to the formation of neurological conditions and diseases. According to a study published in the Journal of Neuroinflammation, curcumin, which is the chemical inside turmeric, can inhibit the production of these pro-inflammatory cytokines following exposure to EMF radiation. A recent study published in the Journal of Chemistry and Neuroanatomy in 2022, so that was just last year, reported that EMFs emitted by mobile phones for 1 hour per day for 28 days significantly decreased the total number of neurons in the hippocampus of hippocampus of rats as compared with the control group. Now, I don't have time to tell you about the hippocampus. It's in your brain. It does a lot of fabulous things. 1 hour a day for 28 days, ruined, reduced the number of neurons, that is the cell messengers, that is the nerve messengers in your hippocampus, and you need that to be healthy. However, curcumin provided significant protection against the EMF mitigated damage, according to their authors. Now, turmeric should not be consumed by people who are pregnant. Turmeric is a blood thinner and may interfere with blood thinning medications. So if you are on blood thinners, I want you to be careful which blood thinner you're on, okay, because some of them are not really, really good, especially the cheaper ones. So just kind of do your own research on that. It may, people with diabetes, gallbladder issues, blood clotting issues, and or endometriosis. If you have endometriosis, you should not be using curcumin. Just throwing that out there. That's a lot of stuff that's out there. Ginseng. We've all heard of ginseng because ginseng is kind of like a little magic herb, okay? It has anti-cancer, neuroprotective properties, as well as pharmacological benefits for people with diabetes or cardiovascular disease. Ginseng may also protect against radiation exposure. In a 2014 study, rats were exposed to cell phone radiation for 4 hours per day for 12 days. Liver cells were damaged and oxidative injury was observed. However, liver cells weren't damaged in rats that were administered ginseng. So we've got some evidence there. So caution for that. Ginseng may interact with certain prescription medications. Both Asian and American ginseng may interact with blood thinning medications. Asian ginseng may also interact with the calcium channel blockers or other medications used for high blood pressure, as well as statins, antidepressants, and people who are on chemotherapy. Women who are pregnant and nursing should not do that. So, again, if I had a choice to be on a medication or to take an herb that would give me the same benefit, I would pick an herb every single time. Ginkgo biloba, that's always a fun one to say, and it absolutely helps the body. It soothes headaches, assists with breathing issues, fights depression and anxiety, and protects against free radicals, assists the diabetics, and protects the brain from the aging process due to its rich antioxidant properties. It may also protect against EMF radiation. There was a report in the International Journal of Clinical Chemistry. Rats were exposed to EMFs from a mobile phone 1 hour each day for 7 days. The EMF exposure resulted in oxidative damage to the brains in the control group. The rats in the ginkgo biloba group they had the ginkgo biloba prior to the exposure to the radiation, and the ginkgo biloba prevented any neuro damage to the rats. All right. So the problem or the caution with this is it has antiplatelet activity. That means it will act as a blood thinner. So if you have a clotting disease, deep vein thrombosis, anything like that, ginkgo biloba has it removes the stickiness from the platelets, so the platelets flow freely and all that kind of stuff. So if you are on anticoagulants, you might not need to take this because this is going to make your anticoagulant work much, much better or much stronger, and you don't need it to be enhanced, okay? So you don't want to do this herb if you are on anticoagulants. Rosemary, okay? Everybody knows about rosemary. EMF exposure decreased the levels of male testosterone in rats. All right, this was according to a study published in the Environmental Science and Pollution Research in 2020. However, male hormone levels in rats supplemented with rosemary leaf extract were seen to improve. In addition, the rosemary inhibited the destructive effects of electromagnetic fields on testicular tissue. So this rosemary is a good thing for men who are worried about their testicles or maybe have testicular issues. This is something that's really, really good. All right. Caution with this is individuals with the following conditions should speak to their healthcare provider before consuming rosemary. If you have gastroenteritis, ooh, we don't want to see that, okay? Gastroenteritis, endometriosis, constipation, epilepsy, neurodegenerative disease, and insomnia. Again, pregnant women should not be doing that. And I'm running out of time, but I've got two more, so just bear with me. Holy basil. Now, holy basil is not the same as the sweet basil that you use in your kitchen, although you could, but that's not usually something that we do. These compounds in holy basil were reportedly able to prevent chemical-induced skin, liver, oral, lung cancers, right? Increasing antioxidant activity, let me read that again. Prevents these cancers by increasing antioxidant activity, altering gene expression, including upregulation of apoptosis and inhibiting metastasis. So apoptosis is programmed cell death. Cancer cells do not have programmed cell death. So holy basil goes into those cancer cells and causes them to die. So if you have cancer, if you're a cancer survivor, holy basil would be something that I would have in my bag of tricks to make sure that it didn't come back. Holy basil should not be consumed by individuals on blood thinning medications or those who have low blood sugar. And the final one, thank you for staying with me, is, and I've never heard of this by this name, okay, it's called Polygonum aviculaire, okay, we know it as knotgrass. That's just how we know it, as knotgrass. But knotgrass is really, really good because it comes against sicknesses or diseases that are particularly anti-aging, and it protects against EMF damage, all right? In a study published in 2011, it reported the protective effects of knotgrass following EMF exposure in rats. Okay, so caution. Individuals who are consuming prescription medications, all of them, or is pregnant or nursing should contact their healthcare provider. Now, another name for this knotgrass is, I think it's called prostate grass. What is it? Yes, it's called prostate knotweed, birdweed, pigweed, and lowgrass. So you might know about that name. Now, if it's prostate knotgrass, knotweed, that means it's going to help you with your prostate. So any guys out there that have prostate issues in your family, this is a good herb for you. And so it will protect, keep the tissues intact, keep the proteins from misfolding, keep the DNA from being damaged. And so you're going to lessen your effects of damage with the EMFs that we're around all day, every day, okay? So I know that was a lot of information. If you have any questions, let me know. We're happy to answer those. Thank you for sharing. Thank you for commenting. Thank you for reacting to this, because Facebook always wants to know if we're providing good content, if we're providing value, and so hopefully we are. These are all foods that you can get in your grocery store. You can get them in your spice rack, or you can go to a good healthcare place and buy them there. There's a lot of different things that we have. Some are in combination. The main thing is, if you eat your fruits and vegetables, you're going to have the antioxidants that you need. Not only do you have to eat them, you have to absorb them. That's why we do the scanner. That's why we do all the things here, okay? So it is the weekend. We love you. Thank you for joining us. Have a great weekend. Do great self-care. And I will see you back here next week for another fun-filled episode. So take care. Have a great weekend. Talk to you soon.